Hi you guys, and welcome to Valley Por Vida. I'm your host Danielle Banda, and today I'm joined by a very special guest. So excited to have Dr. Jaime S. Goez of none other than, of course, Goez Cardiovascular Clinic here in the city of Brownsville. You and your team are amazing. We're so excited to be talking with you today. Thank you so much.
Thank you for having us.
Yeah, absolutely. Now, there is a lot going on here. Your team is always working year-round for the betterment and the health of our Rio Grande Valley patients. So you've got to walk us through, I've got to ask, your newest procedures. Tell me all about it.
I think one of the things that I'm very passionate about is brain health.
Okay.
Because I think if you don't have a good brain, people talk about quality of life.
Yeah.
And really your quality of life will not be good if your brain is not in good shape.
Yeah.
And so one of the things that we focus here at the clinic is in helping people identify problems with the circulation, particularly going to their brain, to protect it.
I know that you also have a very unique approach when it comes to using HCA Valley Regional resources and heart flow scan, and that can be a little confusing to us who are not medical professionals, so kind of break it down for us.
Yeah. Okay, that's a good question. So these techniques are not individual to any particular hospital.
Yeah.
I mean, if you come see us, we can work with you depending on which hospital system you want to be in Harlingen, and Brownsville, and McAllen.
Okay.
But there's a lot of technology that's available. For instance, for the surgeries to protect the blood flow to the brain,
Yeah.
We can actually reverse the blood flow to the brain while we're doing the procedure, so patients don't suffer the risk of a stroke.
Yeah.
You know, because sometimes when you're doing these procedures, you're working in very, very delicate areas, and there can be damage, collateral damage to the brain. So we're very, very careful in protecting the brain when we're repairing the blood flow to the brain. And we have a very strict, very comprehensive screening program to identify patients that will benefit from it. Obviously, you don't want to have a procedure that you're not going to benefit from.
And I know something that's amazing about you and your team is the fact that you offer us options. You don't just tell us what it is and what's going to happen. You inform us about what our best options could possibly be.
Yeah, so options are fantastic. So the way I usually tell patients, look, if you want to meet me at 2 in the morning with an emergency, or me or somebody like me or somebody in the field, you're not going to have a lot of options at 2 in the morning. So the best thing is to come see somebody like us first. See what your options are. There's a lot of fear associated with coming to the doctor, with especially dealing with the brain or the heart. People are very they're scared, you know. So we try to make them comfortable. We try to use technologies like artificial intelligence, like you mentioned, heart flow. Like that's one of the things that we're very passionate about doing these artificial intelligence scans of the heart. They don't hurt. They don't really put you at risk. They're quite safe. They give us a tremendous amount of information about the heart and the blood vessels of the heart and the way the blood flows in the heart. And so we can help people avoid some really critical crises. That's really what we're in the business of. We're in the business of helping people avoid a crisis. It doesn't mean they're going to avoid a procedure. It doesn't mean they're going to avoid treatment. But instead of having it at 2 in the morning in an emergency, we're going to talk about it. And they have options. They don't even have to come with us. We send people to Houston all the time. We send people to the Mayo Clinic. We send people elsewhere if that's what they want. It's not so much about what we do, but of helping them avoid that crisis.
Yeah, absolutely. Very good. Well, we cannot let you go without asking you how we can get in contact with you. You have a physical location, you have a website, you're all over the place. So go ahead and tell us all about that, because we want to talk to you about our health.
Well, what's the best way to get a hold of the city? So calling. We have an office in Brownsville. We have an office in Harlingen, and we're also on social media. Goez Cardiovascular. I think that's a good way to get our address and get our phone.
Very cool. Well, there you have it. Dr. Goez here, of course, of Goez Cardiovascular Clinic. We are so excited for the opportunity to talk to you, and thank you again to you and your team for everything you do for patients of the Rio Grande Valley.
Thank you.
Awesome. All right, you guys. Well, that'll do it for us today on Valley Por Vida, but we'll definitely see you here next time. And yeah, thank you.